Hello and welcome to Ask the Experts. I'm Claudia Otero. Today we're focusing on the opioid epidemic that's impacting not just our community, but it's having a tremendous impact throughout this country. Our experts today are Dr. Kristin Burstedt-Leonard and Guillermo Rodriguez. Dr. Burstedt-Leonard specializes in family medicine, and Guillermo is an emergency department clinical social worker. Thank you both for being here today.
Thank you for having us.
Absolutely. We have some very important topic that we'll be discussing. I do want to begin by sharing with you this information, which is actually very shocking. According to the Centers for Disease Control and Prevention, from 1999 to 2019, nearly 500,000 people died from an overdose involving an opioid. This includes prescription opioids and illicit opioids. And we're going to be talking a little bit about both of these issues, prescription and illicit opioids. This is a significant number. I mean, in 10 years, 500,000 people dead from opioid overdoses. Just let that sink in there for a minute. Let's begin with what is an opioid and what does it do to our bodies? What's it for? What's its purpose?
So opioids are a class of drugs used to reduce pain. Some common forms that we know of today, morphine, hydrocodone, oxycodone, fentanyl, methadone, among others. And they can be available either through prescription, like you mentioned, or yes, illegally manufactured, like heroin or even fentanyl. So yeah, and how does it work in the body? So opioids attach to or interact with receptors in the nerve cells of our brain and body and interact with the pain signals. So they reduce pain, but they also trigger the release of endorphins, which cause you to feel this sense of euphoria. In other words, a feeling or sense of calm or well-being, which makes it very addictive.
Okay, and speaking of addiction, can you talk a little bit about opioid use disorder? This is a different term that we're using these days, right? So what is that? What does that entail?
So opioid use disorder is when a person cannot stop taking opioids, even despite the fact that they are negatively impacting their lifestyle, their daily life. And a person who has opioid use disorder may spend, a significant amount of time trying to obtain the drug or withdrawing from the drug, and it's very serious, long-term brain disorder that has significant, serious consequences, including morbidity and even death.
And as a clinical social worker at our hospital, you are seeing, Guillermo, a lot of these cases coming in.
Most definitely, we're seeing them come in through the ER, and when they come in, it could be an overdose. When somebody identifies with a substance use disorder, they become dependent on, it could be the medication itself or street drugs, such as heroin. And we're seeing that more and more with individuals from all levels that come in through the ER.
Okay.
Yeah, and I'd like to add, prescription opioids are generally safe when given for a short period of time, a couple of days after surgery or dental procedure. But it's the fact that it does produce that euphoric effect makes it quite addictive. And within weeks, someone can start to have tolerance, or they are requiring more and more of the opioid in order to feel that same effect.
So I think it's probably very important for somebody who is going to have a procedure performed, whether it's minor surgery or, as you mentioned, dental work, to have that conversation with their provider, right?
Yeah.
What's appropriate? I know you're giving me a prescription for 8 to 10 days, but do I really need to take for that long?
Right.
So have those kinds of questions ready. And if they aren't already providing that information, you should be asking those questions. Earlier in the opening, I mentioned opioid epidemic. Can you tell us, what exactly does that mean?
So the opioid epidemic refers to the increased number of deaths over the past 20 years. It can be broken into 3 phases or 3 waves. So initially with the increased prescribing of opioids in 1990, we were seeing, increased amount of overdose deaths from prescription opioids. And at that time, surprisingly enough, we did not realize the addictive potential of opioids, and it became clear pretty quickly thereafter. And unfortunately, pharmaceutical companies downplayed that quite a bit. And then in 2010, there was a second wave where we were seeing opioid overdose from heroin. And then in 2013, opioid overdose primarily from fentanyl, or increasingly amount from fentanyl since then.
And then, like you mentioned in the beginning, the CDC, it's an epidemic across the nation. And when we talk about that, it's the overdoses are happening and they're skyrocketing. In 2019, there was about 71,000 individuals that died from an overdose, from an opiate overdose. 2020, there was over 92,000. So it continues to increase, and we're seeing the problem rising and rising. The government is trying to do as much as they can, but it's the education, information, and it's dangerous out there still.
Sure. I mean, I remember just a few years ago, and just watching the news or reading a newspaper or online, and you start reading about all of these different schools in different states where they're now having to have Narcan, right? Or EMTs and firefighters, police officers having to go to work and having that drug that basically revives a patient who's suffered an overdose in their vehicle. So that has kind of become the new norm.
Yeah, it's becoming part of their training as new officers.
Yeah, and we're going to talk a little bit about Narcan and that a little bit later, but I do want to go back to the opioid epidemic and how has that changed here in Monterey County in the last few years?
Well, it's changed to the point where information is out there in regards to the dangers, the potential dangers of an overdose, but individuals who are addicted still have a hard time to let go, to find treatment, to get help. So the counterfeit pills are out there, such as, they call them the blue pills, and they have fentanyl in them. And so it's destroying the communities, destroying our youth, destroying families, and creating a very dangerous scenarios for a lot of individuals in Monterey County. So information is out there, Narcan is out there, ERs are out there, the doctors, but it's about how to get the help, where to go to, how to ask these questions. And the issue is getting, I don't want to say bigger and bigger, but more individuals or our youth are kind of playing Russian roulette, you want to say, with these medications.
Sorry, I wanted to add to that data shows that in our community, young people, like Guillermo was saying, from 14 to 29, we're seeing a significant increase in opioid overdoses. And there's data from 2018 to 2020, individuals ages 20 to 24, the opioid overdose deaths in overdoses in 2018 was 40 something, and in 2020 155, so triple that amount.
That's very sad.
Yeah.
I know recently we had a case in South Monterey County where an 18-year-old teenager passed away from an opioid overdose.
Yeah.
That's very sad because they're just starting that second phase of their life, and that happened. Where are you seeing the most amount of overdose cases in Monterey County, or even if you want to talk about the Tri-County area?
Well, to really pinpoint is very difficult because the data could be very skewed. I believe it's happening across Monterey County in itself. We're seeing most recently, like you talked about, Soledad, South County. There's issues happening down South County. We have more deaths happening in North County, such as the Monterey Peninsula area. But it's like, where do you define where is a higher percentage of deaths happening? It's within the population, education, and if there's Narcan being distributed and such programs being offered. We know that programs are offered in North County compared to South County, where it's very rare to have programs out there.
Okay, so we do need more outreach in Monterey County.
Correct.
Okay. And I want to add too that all communities in Monterey County are affected. Every individual, there's no, income or age range or location that's not affected. So it does affect everyone. Certainly, we're seeing it more in some places than others, but it is affecting all of us.
And that's really important because I think some people might still have the frame of mind that it's a certain group of people, perhaps in a certain community known for drug use, that are having these issues, right? But that's not the case. It can be grandma, it can be grandpa, it could be any one of us, which is not. But I mean, it can literally be anybody. It could be your teenage child, right?
For sure.
So,
Absolutely.
Yeah. Like one of the sayings, addiction does not discriminate.
okay, addiction does not discriminate. That's good to remember. How are we treating patients with these issues?
Definitely we partner with each patient to find to consider the best treatment for that individual. But treatment oftentimes includes a combination of counseling and including rehab and social support, family support, and also oftentimes too opioid replacement therapies, so such as buprenorphine and methadone. And just to kind of go into that a little bit further, so when an individual is suffering with opioid use disorder, the brain actually reorganizes itself to prioritize the drug over everything else. So, it oftentimes, or someone can deprioritize, or even something as simple as eating, sleeping, and relationships. And so in recovering from opioid use disorder, the brain takes up to 2 or even more years to heal.
Wow.
Yeah, so that's why during the recovery period, it's so helpful to be on opioid replacement with an opioid that is safe and prescribed, and in that way, the individual can focus on getting better and not, trying to obtain the opioid. They can then just focus on, getting back and rebuilding their life. And actually, one more thing, there are not just theoretically, but looking at how people do on Suboxone or buprenorphine. For instance, we do see a significant survival benefit. So more people living when they're on Suboxone or buprenorphine or methadone versus not.
And again, those medications are prescribed, and it's something that your physician is, just
monitoring, finding the proper dose for you, and you know that you have a safe place to obtain this medication, and then you can go on rebuilding your life. But yes, it's safe, it's prescribed, and it's you know what you're getting.
Right. Mm-hmm. That's very important. We briefly talked about this earlier, street drugs. They are a big problem, always have been, probably always will be, right? But the ones laced with fentanyl, I mean, those are unfortunately ending a lot of lives.
Yeah.
So let's talk about fentanyl and why is it so dangerous? What is fentanyl? I guess that would be the first question.
So fentanyl is a man-made opioid. It's 50 to 100 times, even stronger sometimes, but 50 to 100 times stronger than morphine. And so even a small amount, 2 to 3 grams, which is just a pinch of fentanyl, can lead someone to overdose.
Okay, and so when that happens, what is happening to the body? Can you talk a little bit about that? And how much time do you have to get Narcan, for example, if you can kind of walk us through that process?
Yeah. So, when opioids, and any opioid really, at a high enough dose, can shut off the brain's ability to control breathing. So someone can stop breathing, or, breathing can become irregular and very, very slow. So once that happens, there's only minutes really that somebody can go without having oxygen to the brain, and then minutes as well where the heart can stop. And so you have a window where you can hopefully treat with Narcan.
Okay, which is why you have police officers, paramedics going about their business, their job with Narcan in their vehicles, right? Because literally you have minutes to save a person's life.
Yeah.
Okay, and let's talk about Narcan. What is it and how does it work?
Yeah, Narcan is also called naloxone. It works by knocking opioids off the receptor and reverses the effects of opioids.
Okay.
I did want to say one other thing too.
Sure.
I forgot to mention what's happening with fentanyl in counterfeit pills. Fentanyl, when it's manufactured illegally, it's actually really cheap, and so oftentimes illegal manufacturers will cut it into a pill that looks like something else. And so, oxycodone, for instance, a small pill of oxycodone shouldn't cause someone to overdose, but if there's fentanyl in there unknowingly to the person who takes it, it can be deadly.
Which is why it's really important to have Narcan around, not just with EMS or police officers, but now
in the schools,
the
right?
schools, families at home in your medicine cabinet, because you just never know what's going to happen. And being able to use or administer Narcan in a timely manner will definitely save a life. Like in regards with fentanyl, right? These pills mimic exactly like the original pill, so it's really hard to determine, are they taking the original pill or a pill that's tainted with fentanyl? It's just, like I mentioned before, Russian roulette, and it's causing all these overdoses within our communities.
Sure, and then when you get into situations where, let's say you're at a party, right, you're in college, you're going to the clubs or a frat house or one of those situations, and you think somebody's giving you, a safe, let's say, quote unquote, safe, club drug, whatever that is, you don't know what it's laced with, if it's even laced with anything. So next thing you know,
Yeah.
we're reading a terrible headline, right? So,
Right.
Definitely.
And it doesn't have to be an opioid like Percocet. It can be Adderall, or it can be
Molly,
cocaine.
MDMA,
Yeah,
anything.
anything that can be laced with fentanyl.
That's true.
Well, that's very important. Thank you for including that information. Narcan, is it easily available? Can anybody pick a box up somewhere? Or do you need a prescription? What can you share with us?
Well, usually, it can be prescribed for someone who's being prescribed an opioid medication. Usually nowadays, it's, Narcan should be prescribed to that individual just for the what-if scenarios. But you could easily go to your local pharmacy, to the emergency department, to a lot of these substance use providers. They have them on stock and be able to, it takes about maybe a few minutes to be educated how to use it, but also the box itself has...
You have a box right there.
Yeah,
for us.
it has the information and pretty simple instructions to really administer. It's in English to be able to give the information and administer Narcan.
And the average person, right, should, anybody should have one of those boxes at home, because you
Yeah.
never know when you might
Yeah.
need one.
Absolutely. Yeah.
Okay. Well, it is very important that we all know how to administer Narcan. So we do want to show you a video. Take a look.
And here today to demonstrate how to administer Narcan, which is a life-saving treatment, which you should administer to people who you suspect have overdosed on opioids. So we have our person here who we suspect has overdosed. So we're going to go ahead and make sure that the environment is safe, and then going to attempt to wake the patient. So you can, shake, you might pinch or rub on the sternum. And in this individual, they're not responding. And so then I would go ahead and call 911, and then or ask someone to call 911. And I'm going to go ahead and open the Narcan device. And you can see here, put your fingers there, and this is the area to push. So I would go ahead and prop her head back, make sure that, okay, and then you administer in one nostril, and go ahead and push to administer the Narcan medication. Then you go ahead and wait 2 minutes, and if at that point they're still not responding, go ahead and administer another spray in the other nostril. I also want to make a point to say that Narcan is safe to give to people who, even if they have not overdosed on opioids, it will not harm them. So if you have any suspicion at all, go ahead and administer it.
And there you have it. Thank you, Dr. Leonard, for showing us how to properly administer Narcan. How is the hospital rising to deal with these issues?
Yeah, so our hospital has been working to combat this on multiple levels. So, for instance, making sure that we can detect fentanyl on urine toxicity screens when someone comes to the emergency room. It wasn't always available, but now that we're seeing, more and more of this, making sure we can detect it and know that somebody has overdosed on fentanyl. Making Narcan available to anyone who requests it. So you do not need, it's anonymous. Anybody who wants one can get one in the emergency room or at the hospital. And we're working to distribute that, in local events as well, which we'll talk about a little later. And then partnering with our social workers and local providers to make sure that we're, providing access to opioid use disorder treatment, and educating providers on buprenorphine prescribing, so that's more available.
And then being a social worker within the emergency department, so I do an assessment with these individuals and then be able to connect them to a provider outside of the agency, connect them by helping them making an assessment, schedule the assessment, get them into treatment, getting them Narcan, educating on Narcan, educating on the substance, the dangers of fentanyl, in case they're not aware, how it's really out there. It's really out there, and really kind of drive it into them so they understand. And sometimes we do get buy-in. They want support with getting treatment, and that's where I come in, connect them and support them. Even when they get discharged, I still follow up with them to make sure they are following with the services.
And that's great, and we appreciate all the work that you're doing, not just the two of you, but the entire system and your colleagues. So thank you for doing that. Let's talk a little bit about counterfeit drugs. So what are these counterfeit pills, and why are they so dangerous?
So kind of harking back to what we talked about a little bit ago. So basically, the individuals who manufacture these illegally will produce counterfeit pills that look like another. So we have a image for you to see. It looks like any other oxycodone pill, for instance, or Adderall or Xanax. But actually, the counterfeit may have some oxycodone in it, but it has oftentimes cut into it fentanyl because it's actually cheaper to produce, and so it looks like something else, a Trojan horse. It looks like something else, but unfortunately, it can be deadly. Just one pill.
And again, if you're trusting somebody at a party or at the club and somebody's handing you a pill that you've taken in the past that was just a typical let's have fun drug, which you shouldn't be taking anyways, this could be the outcome right there. Yeah. So, okay. Parents, there are a lot of parents out there who think my child would, and we've had the conversations, my kids don't do drugs, they would never do fentanyl, or obviously not knowing that maybe it's drugs that are laced with fentanyl. So how should parents be, discussing these issues with their kids? And when do you start? I mean, do you start having those conversations when children are 8 years old, as an example? Or, I mean, how young do you need to be?
Well, I mean, that's a great question, Claudia, because this topic is very sensitive just across the board. When to start is the question, right? When they're in elementary school, middle school, high school, I believe at any given point that they're able to have these conversations within the family unit to be able to get education about Narcan and everything else, because they don't know what's happening out there. We're not with our children 24/7 out of the day. They could be at school, after school, wherever it's at. They could be offered something, and just addiction itself.
You could be roofied?
Yes, you could be out of curiosity, be able to take it, and that could be the end for you. Having these conversations is really important to be able to know how to protect yourself, how to say no, what to do, call law enforcement, let the principal know if there's a student selling these pills, and maybe carry this in your backpack, giving it to your child. Sometimes it's like, how am I going to give this to my child? But why not? It's harmful, but it saves lives.
Sure.
Harmless.
Yes, harmless.
Harmless. Well, sure. I mean, if we are vaccinating kids for a number of diseases, right? Gardasil 9 for cancer or COVID, let's say, why wouldn't we be having this very honest talk with our kids at any age? So consistency. You probably want to have that conversation for throughout, right? You want to
Yeah.
be consistent.
Yeah.
Right. And ask questions, you know, do you know what fentanyl, have you heard of this? Have you heard of carfentanil, which is a derivative of fentanyl? I've heard even stronger than 100 times the strength of morphine. And yeah, so asking questions, and I think sometimes too, just may seem as though they're not listening, but you know, definitely just they probably are.
Yeah.
Just keep talking with them, you know?
Yeah, no,
Yeah.
and one thing that you said, Guillermo, is to, you know, kids, you said if they know of somebody, a classmate who's dealing these drugs or handing them out, whatever it is, you know, to report them, right?
Yeah.
With the teacher, with the principal, with the police officer, if there is one there on campus, because you could be saving somebody's life
Yes.
at the end of the day. We do know that in the case in Gonzalez, that has become a homicide investigation.
Yes.
So that's something else to think about.
Yeah.
Yeah. Is there anything else either one of you want to say?
And I do want to add just,
Sure.
if families have any questions about anything, they could always ask for the social work team. Just also dial 211. It's a general number with information. Ask for a therapist or a counselor. It's best to ask questions and get it out of the way than not ask questions and find your loved one dead from an opioid overdose.
And I'll say our social workers are extremely, you know, easy to talk to. So I can say that from experience. So
Thank
please
you.
do, yeah, reach out.
Yeah.
Very easy to talk to, as you have just witnessed here. Well, thank you for that, and that's very important. If you or someone you know has an opioid use disorder or addiction, there is help available. We've been talking about that. You're looking at your screen there at some of the organizations that offer all sorts of help. You have the Sun Street Centers there and Door to Hope, among others. We'll keep that on the screen for just a few more seconds. And of course, you can always go back and watch this video here on Facebook to look at that information. Dr. Leonard, Guillermo, thank you so much for being here today. We really do appreciate your time. We know that you're very passionate about this topic. You're obviously seeing a lot of these cases, probably way too often than so we really do appreciate everything you are doing for our community and for being here today.
You as well.
Well, thank you very much. Appreciate that. To our viewers, we do ask that you please like and share this video. Again, the information is there, it's free, and you can save lives just by doing that. Just share this video. Please follow us, obviously right here on Facebook, but also on Twitter, LinkedIn, and Instagram. We always appreciate your feedback. On behalf of Dr. Leonard and Guillermo, we thank you for watching. I'm Claudia Otero. Take care.